Hello, my name is Brooke Palmer and I'm a senior athletic training student at Florida Gulf Coast University, and today I will be demonstrating how to conduct a SCAT5 concussion assessment. The SCAT5 has an immediate or on-the-field assessment as well as a more in-depth off-the-field or office assessment. So for step one, you want to know any observable red flags, and these include neck pain or tenderness, double vision, weakness or tingling, burning in arms or legs, severe or increasing headache, seizure or convulsion, loss of consciousness, deteriorating conscious state, vomiting, or increasingly restless, agitated, or combative. Step two are observable signs. There are 4 of these, and you also want to note if you witnessed or observed this on video. So you'll circle yes or no. The first one is lying motionless on the playing surface, balance/gait difficulty / motor incoordination, stumbling or slow, labored movements. The third one is disorientation or confusion or an inability to respond appropriately to questions. The fourth is blank or vacant look, and the fifth is facial injury after head trauma. Step 3 is memory assessment with the Maddox questions. So I'm first going to read this to him and he will tell me what happened. I'm going to ask you a few questions. Please listen carefully and give your best effort. First, tell me what happened.
I was running the ball and I got tackled and his helmet hit my helmet pretty badly.
Okay. What venue are we at today?
Football.
Which half is it?
Second.
Who scored last in this match?
I don't remember.
What team did you play last week?
Naples.
Okay. Did your team win the last game?
No.
Step 4 is the Glasgow Coma Scale, and there are 15 you want to observe. First, I would note the time of assessment and the date of assessment. And for the best eye response, no eye opening in response to pain, eye opening to speech, and eyes opening spontaneously, 1 through 4. You will grade those. And then best verbal response is a 1 through 5 with no verbal response, incomprehensible sounds, inappropriate words, confused, or oriented. And then the best motor response is out of 6. And the first one is no motor response, extension to pain, abnormal flexion to pain, flexion or withdrawal to pain, localizes to pain, and obeys commands. And then you would add all those up. The next is the cervical spine assessment. And I would actually do this after the red flags because that is more of a initial assessment. You want to make sure everything is okay with the cervical spine. So does the athlete report that their neck is pain-free at rest? Yes or no? And then if there is no neck pain at rest, does the athlete have a full range of active pain-free movement? Yes or no? And is the limb strength and sensation normal? Yes or no? So that completes the initial, immediate, or on-the-field assessment. But I just want to note, in a patient who is not lucid or fully conscious, a cervical spine injury should be assumed until proven otherwise. So for the office or off-the-field assessment, I'm going to begin with step 1, which is filling out the athlete's background, the sport, the team, the school, the date and time of injury, the years of education completed, so what grade they're in, how old they are, gender, if they're male or female or other, dominant hand, left, neither, right, how many diagnosed concussions has the athlete previously had, when was the most recent concussion, and how long was the recovery from the most recent concussion. And we'll put those in a days. And you want to answer, has the athlete ever been hospitalized for head injury, diagnosed or treated for headache disorder or migraines, diagnosed with a learning disability / dyslexia, diagnosed with ADD or ADHD, and diagnosed with depression, anxiety, or other psychiatric disorder. And we want to know also if they're taking any current medications, and if so, we would list them. Step 2 is symptom evaluation. So the athlete should be given the symptom form and asked to read this instruction paragraph out loud, then complete the symptom scale. For the baseline assessment, the athlete should rate his or her symptoms based on he or she typically feels, and for the post-injury assessment, the athlete should rate their symptoms at this point in time. So I would give him this form, hand it to him, and he would fill out his symptoms. So 0 would be no symptoms, and then it goes up to severe symptoms, which is a score of 6. And I would just read those aloud if I were to hand it to him. Headache, pressure in head, neck pain, nausea or vomiting, dizziness, blurred vision, balance problems, sensitivity to light, sensitivity to noise, feeling slowed down, feeling like in a fog, don't feel right, difficulty concentrating, difficulty remembering, fatigue or low energy, confusion, drowsiness, more emotional, irritability, sadness, nervous or anxious, trouble falling asleep. And then I would total the number of symptoms, and I would give him a symptom severity score. And I would ask him, do your symptoms get worse with physical activity? Yes or no? Do your symptoms get worse with mental activity? Yes or no? And then I would say, if 100% is feeling perfectly normal, what percent of normal do you feel? And if not 100%, why? And then he would hand this back to me, and I would look over that. So step 3 is cognitive screening. So beginning with orientation, I would ask him, what month is it? What is the date today? What is the day of the week? What year is it? What time is it right now? And you want that within 1 hour. And that's an orientation score out of 5. Next is immediate memory. The immediate memory component can be completed using the traditional 5-word per trial list, or optionally using 10 words per trial to minimize any ceiling effect. All 3 trials must be administered irrespective of the number correct on the first trial. Administer at the rate of 1 word per second. So you either choose the 5 or the 10 word list groups and circle the specific word list chosen for this test. So I'm going to choose list A, and I would read this aloud. I'm going to test your memory. I will read you a list of words, and when I am done, repeat back as many words as you can remember, in any order. For trials 2 and 3, I am going to repeat the same list again. Repeat back as many words as you can remember, in any order, even if you said the word before. Finger, penny, blanket, lemon, insect.
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 Okay, and he will get his immediate memory score out of 15. And you will also note the time that the last trial was completed. So next up is concentration, and this is the digits backwards. So I would circle a digit list that I choose, and for this one I'm going to choose list A, and I would administer at the rate of 1 digit per second, just like we did with the immediate memory. If I read it, if correct, I'll circle Y for correct and go to the next string. If it's incorrect, I will circle N for the first string length and retrial 2 in the same string length. So list A, 4, 9, 3.
3, 9, 4.
6, 2, 9.
9, 2, 6.
So since he got both of those right, I would give him a score of 1, and I will move on to the next string. 3, 8, 1, 4.
4, 3, 8, 1.
3, 2, 7, 9.
9, 7, 3, 2.
So since he did not get those correct, we will not move on, and he will be given a score of 0. So next is months in reverse order. Now tell me the months of the year in reverse order. Start with the last month and go backward. So you'll say December, November, go ahead.
December, November, October, September, August, June, July, May, April, March, May, February, and then January.
Okay. So I would give him a score for that out of 1, and then I will have a concentration total score of the digits and plus the months. Step 4 is the neurological screen. So can the patient read aloud and follow instructions without difficulty? So that would be with the symptom checklist when I handed it to him and he read it aloud. If he did it correctly, I would mark yes or no. So if he did it right, he would get yes, and if he did it wrong, he would get I would circle N. Does the patient have a full range of pain-free passive cervical spine movement? So I would ask him if he's having any pain as I go down, come back, left, right, lateral. There. Any pain with that? No. So no pain, I would circle no. Without moving their head or neck, can the patient look side to side, up and down without double vision? So can I go ahead and have you look side to side? And then up and down. Good. Any double vision? So yes or no, and no. Can the patient perform the finger-nose coordination test properly? So I'll read this aloud to him. I'm going to test your coordination now. Please sit comfortably on the chair with your eyes open and your arm, either right or left, outstretched, pointing in front of you. When I give a start signal, I would like you to perform 5 successive finger-to-nose repetitions using your index finger to touch the tip of the nose, and then return to the starting position as quickly and as accurately as possible. Are you ready? Go. Okay. So he did perform that correctly, so I would circle yes. And then the final one is, can the patient perform tandem gait normally? So I will have him go on the end of this line. And the patient is going to stand with his feet together at the starting line and then walk in a forward direction as quickly and as accurately as possible along the sports tape, with an alternate foot heel to toe gait, ensuring that they approximate their heel and toe on each step. Once you cross the end of the line, I want you to turn around and return to the starting point using the same pattern, the same walking pattern as you did to begin with. So go ahead. Good. You may have a seat. So the athletes fail the test if they step off the line, have a separation between their heel and toe, or if they touch or grab the examiner or an object. So he did not do any of those. He did it great. So he would get yes. So next up is the balance examination, and there are three: the double leg stance, the single leg stance, and the tandem stance. So I am going to observe for a few different errors. There are six. The first one is hands lifted off iliac crest. Second is opening eyes, step, stumble, or fall. The fourth one is moving hip into greater than 30 degrees of abduction. 5 is lifting the forefoot or heel. And the last one is remaining out of test position for greater than 5 seconds. So I'll read this aloud and we'll perform the test. I'm now going to test your balance. Please take your shoes off, roll up your pant legs above the ankle, and remove any ankle taping. This test will consist of 3 20-second tests with different stances. The first stance is standing with your feet together with your hands on your hips and with your eyes closed. You should try to maintain stability in that position for 20 seconds. I will be counting the number of times you move out of this position. I will start timing when you are set and have your eyes closed. So we wait 20 seconds, observe for any errors, and mark those down. Okay. Single leg stance is up next. If you were to kick a ball, which foot would you use?
My right foot.
Okay. Now stand on your non-dominant foot. The dominant leg should be held in approximately 30 degrees of hip flexion and 45 degrees of knee flexion. Again, you should try to maintain stability for 20 seconds with your hands on your hips and your eyes closed. I will be counting the number of times you move out of this position. If you stumble out of this position, open your eyes and return to the start position and continue balancing. I will start timing when you are set and have closed your eyes. Okay, observe for any types of errors and mark those down. The next is tandem stance. Now stand heel to toe with your non-dominant foot in back. Your weight should be evenly distributed across both feet. Again, you should try to maintain stability for 20 seconds with your hands on your hips and your eyes closed. I will be counting the number of times you move out of this position. If you stumble out of this position, open your eyes and return to the start position and continue balancing. I will start timing when you are set and have closed your eyes. I will begin, and again, mark any types of errors. You can have a seat. Again, I would note on the balance examination where you fill it out which foot was tested. So his non-dominant foot was his left, so I would circle that or check that. And then the testing surface, so we wouldn't normally be on carpet, but we are, so I would note that there. And his footwear, if he was wearing shoes, if he was barefoot, if there was any tape or braces on there. And then I would calculate the number of errors in the double leg stance, in the single leg stance, and the tandem stance. And then I would add up all of those errors for a total. Step 5 is delayed recall. The delayed recall should be performed after 5 minutes, have elapsed since the end of the immediate recall section. Score 1 point for each correct response. So do you remember the list of words I read a few times earlier? Tell me as many words from the list as you can remember in any order.
Lemon, penny, insect, pillow, apple.
Okay, good. Please record each word correctly recalled and total the score. The total score equals the number of words he recalled. So I would score that right where it says to do that for the total number of words recalled accurately. And step 6 is the decision. So I would note the dates and times of the assessment, and I would then total up all of the symptom number, symptom severity score, orientation, immediate memory, concentration, the neuro exam, balance errors, and delayed recall. So it says here, again, at the top, date and time of injury, and then if the athlete is known to you prior to their injury, are they different from their usual self? And you can mark yes, no, unsure, or not applicable. Concussion diagnosed, you would check that, yes, no, unsure, not applicable. And then if retesting, has the athlete improved? And again, yes, no, unsure, not applicable. And here I would say, it says, I'm a physician or licensed healthcare professional, and I have personally administered or supervised the administration of this SCAT5. I would sign it, write my name, my title, my registration number, and date it again. And I just want to note again, finishing the SCAT5, that scoring on the SCAT5 should not be used as a standalone method to diagnose concussion, measure recovery, or make decisions about an athlete's readiness to return to competition after concussion. Thank you. I just want to do a quick follow-up and talk about what findings in each area. Each section would suggest that the patient may be concussed. For the total number of symptoms, the maximum possible is 22, except immediately post-injury. If the sleep item is omitted, that we had the athlete read them aloud. If they didn't sleep and it just happened, then that number would not be 22. It would be a maximum of 21. So, and then for the symptom severity score, we would add all the scores up in the table, and the maximum possible is 22 times 6, which is 132. And again, if sleep is omitted, we would only have 126. So if the more, if there's 132 symptoms for the symptom severity score out of 132, then, that just states that the concussion might be very bad. 132 out of 132 would not be good. So the greater the number, possibly the more severe the concussion.